Hello, guys. I'm Dr. Bibilari Adeusi. I'm a clinical microbiologist. You can also call me a medical microbiologist. So, what we do is that we diagnose and treat infectious diseases. We do this in two ways. We do that with one is clinical diagnosis when we see patients on the ward, patients that are suspected to have infections. We look at them, examine them, and then we make clinical diagnosis on the wards. But usually, infections go beyond just clinical diagnosis. We also need a laboratory diagnosis, okay, or what we call a microbiological diagnosis. So we also need patients, and we also need samples from patients on the ward that are suspected to have infections, and then we work on the samples in the laboratory. So I just want to show you a little about what we do in the clinical microbiology laboratory. For mostly when we receive samples, we inoculate them on what we call Heger plates. Let's say, for example, we receive blood sample or we receive urine sample. We inoculate the urine sample, just take a little bit of the sample, inoculate it on an Heger plate, and observe for the growth of microorganisms. Usually, we leave the Heger plates, we say we incubate it for 24 hours. So we observe for growth of microorganisms. So if anything grows on it, what we want to do is we want to identify the organism, and we also want to do antimicrobial susceptibility testing to know which antibiotics is going to be useful for the infection. So, for example, this is an Heger plate that I'm holding on here, and then this particular plate has growth of organisms on it. So, for example, when we have a growth like this, what we want to do is we want to identify which organism or which bacteria is this, and we also want to do check which antibiotics is going to work for it. We call that process antimicrobial susceptibility testing. We do that on another plate. This is a plate for antimicrobial susceptibility testing. If I open it, if you look closely, you will see some white discs, round white stuff that have some letters on them. We call them antibiotic discs. So we inoculate this plate with the organism, then we place the antimicrobial disc or antibiotic discs on the plate, and then we observe for what we call zone of inhibition. If you look at this plate, you will see that there is like a clearing around each of the antibiotic discs. So that clearing is what we call zone of inhibition. It's that zone of inhibition that we measure that helps us to know whether a particular antibiotics will work for an infection or not. For example, I have a urine sample here that I want to work on. So what I'm going to do to this urine sample is that I'm going to inoculate on plate. I have unused plates here. This is one plate. This is another plate. So I'm going to inoculate this urine sample on those plates, and then I will leave them to grow for 24 hours. I will bake them for 24 hours. Then I will observe for growth. If there's growth, what the next thing I want to do is I want to identify which organism is there, and then I also want to do antimicrobial susceptibility testing, because that's what will inform which antibiotics or the choice of antibiotics to use in treating the infection. So thank you for watching. I'm Dr. Bibilari Adeusi. I'm a clinical microbiologist. See ya.